Let's see. So Duane's retraction syndrome is a congenital cranial dysnervation disorder, and it's typically neither syndromic nor from gene mutation. It's a problem with the sixth nerve innervating the lateral rectus and to a variable amount, and a variable amount of abnormal innervation from the third nerve nucleus. Duane syndrome is common. It's estimated 1 out of 1,000 individuals, and it's estimated out of every 100 patients with strabismus, one of them has Duane syndrome. What does that mean? That means that we're going to see plenty of Duane syndrome patients who have other things as well. It doesn't mean that it's related to the Duane syndrome because Duane syndrome is so common. Here's a girl with Duane syndrome in the right eye and corneal haze. Is this a new neurodegenerative syndrome? No, this patient has CHED, congenital hereditary endothelial dystrophy, an autosomal recessive condition, and just coincidentally happens to have Duane syndrome. This is a boy referred as a possible new neurodegenerative syndrome. He's got Duane syndrome, deafness, myopia, retinal dystrophy, certainly all neurological things. Does he have a new syndrome? No, he has Usher syndrome and just coincidental plain old Duane syndrome. Another patient with Duane syndrome, retinal changes, I think you have the idea. Duane syndrome is common, so when we see something extraocular or extraocular motility related, it's usually just a coincidence. Having said that, there are some Duane syndrome syndromes, and I'd like to share some of them with you now in the rest of this presentation. Sometimes we really do have syndromic Duane syndrome or Duane syndrome from gene mutation. Again, the Duane syndrome we see day in and out in the clinic is typically not from gene mutation, and it's typically not from syndromes, but here are some exceptions. This is one I think we've all encountered, this patient with Duane syndrome in the right eye, hemifacial microsomia, deafness, auricular malformation. This is the so-called oculo-auriculovertebral dysgenesis. A term that's thrown out a lot is Goldenhar syndrome. This is a recognizable malformation complex that we see. There's no known gene mutation associated with this, but we see it recurrently. It's typically not inherited. Something goes wrong in embryogenesis. Here's a 12-year-old boy with Duane syndrome in both eyes and deafness. He also has fused cervical vertebrae, known as the Klippel-Feil anomaly. This is the so-called Wildervanck syndrome, cervico-oculo-acoustic syndrome. Again, a recognizable malformation complex that's not hereditary, not associated with any known gene mutation. And this case is a little unusual because usually they're females. This is a boy who's affected. This woman has bilateral Duane syndrome. She also has a right facial palsy, and she has an absent right ear. This is really suggesting something went wrong at the time the sixth nerve is supposed to be innervating the lateral rectus around the 4 to 6 weeks of gestation. And there are certainly gene mutations that can cause this, but something else that can cause it, we don't see it as much anymore, is a teratogen, such as thalidomide. So when there's some sort of disturbance happening at that critical period between 4 to 6 weeks of embryological development, we can see Duane syndrome and other associated findings that are also related to things that are developing in that same time period. There are some gene mutations that do cause syndromic features like this. It's not always teratogen. One example is SAL4 mutation. SAL4 is a transcription factor. Mutation in this gene causes so-called Duane radial ray syndrome. And again, it's affecting embryogenesis at that critical period, those structures that are developing 4 to 6 weeks of development. Now, I said that most Duane syndrome is not from gene mutation, but there are some cases that are, and this patient has the most common gene mutation associated with Duane syndrome. She's got bilateral Duane syndrome, she's deaf. Some people in the family have unilateral Duane syndrome. Some people in the family have it with deafness. Some people don't. If you have hereditary Duane syndrome running in the family, the most common gene that's associated with that is this gene here, AMFB. It's a transcription factor. It's the most common hereditary form of Duane syndrome. The second most hereditary form of Duane syndrome is represented by this case. This patient has bilateral Duane syndrome. Patients with this mutation also often have vertical abnormalities. This is from mutation in a gene CHN1. This is responsible for axonal guidance. MAFB, the previous case, and CHN1, this case, these are the two most common causes for isolated hereditary Duane syndrome. So if you see a family with Duane syndrome, most likely it's mutation in one of these two genes. Now this is a rare one, but it's important to be aware of. This patient has Duane syndrome in both eyes, deafness, and autism, as does his sister and the younger brother. And if you ever have bilateral Duane syndrome with autism, this is something that alarm bells have to go off on. This is associated with mutation in a developmental gene that's responsible for early embryogenesis of the brainstem. This is the so-called HOXA1 Duane syndrome. And the reason that it's important is because it's associated with cerebrovascular abnormalities, and these patients need to be evaluated for that possibility. Here's another patient with HOXA1-related Duane syndrome, and you can see on the right, he has agenesis of the internal carotid. They have these, they're at risk for strokes. So if you ever see a patient with Duane syndrome and autism, bilateral, these patients need to be referred for evaluation. With this, I'd like to conclude. Duane syndrome is a CDD spectrum that we see all the time in our clinics, and usually it is not syndromic, and usually it is not from gene mutation. If you see what appears to be a syndromic Duane syndrome, more likely it's a coincidence. However, there are some recognizable syndromes. Some of them are not known to have any known genetic basis, but others are, and I've highlighted some of them in this presentation. Thank you so much.